Welcome, dear viewers, to our natural medicine format today. Today we have a panel of experts from the developers of Kleinsche Fields and Dr. Petra Wiechel, head physician at the Swiss Mountain Clinic. We're going to look at the subject of stress today and see what their experiences are. Petra, in the clinic, you really have this practical experience with the patients. Where do you use the Kleinsche Fields when you work biologically as you do?
Then it's always about restoring normal, healthy, fundamental living conditions, circulation. In medicine today, we express good blood circulation by using the carotid artery and say, great. But that's an 8-lane highway to what the body really has to offer every cell for 4 and 20 hours. Has to offer every cell, namely to have oxygen present. Life is pretty much about that, because if the oxygen is not there regularly, it has consequences for cell health. We take care of that because we see that, and that's why the Kleinsche Fields are one of the most important, even basic elements for us, I would say, in order to build a supportive bridge to capillaries, to cells, for an organism that has become ill on many levels.
To act better at the cellular level, now that you've just said the review. Doesn't make any sense. The 8 of the highways, once it's closed, then the baby has already fallen into the well, hasn't it? How can of course you can sort it out again.
Life, whether you have a stroke or a heart attack, doesn't depend on it, whether the carrot is closed or a supplying vessel. I would venture to say from observation that if the compensation by the microcirculation, and the viewer can imagine this, at the beginning the aorta here really has 8 lanes, and then this cross-section of the vessels, the arteries, changes, and at the end it is only filigree. And the red blood cells, which are responsible for this, have to get in line a bit, and they have to have a high degree of flexibility of their own, otherwise they can't get through. But behind them is the heart cell, behind that is the liver cell, behind that are all the brain cells. And that is fundamentally the most important thing, so that information light, nutrients reach the cell level at all. And that's why we work with it. And I just realize it's another one. How should I put this? A passive active support that I am giving at the moment, for example, with the infusions. My infusion, which I give with information, micronutrients, is for nothing if it doesn't also get there. And that makes it natural, or the first experience, or better. We also give it to people so that they can sleep on it. You can feel it. Does my sleeping behavior change? And the first patient who slept on it was someone with severe cardiac insufficiency. That means the heart is no longer pumping strongly enough, and always legs like this. And water pills, and more water pills, and even more water pills, and more water pills. It was unbelievable what happened during the night. And it was unbelievable what followed, how the body found its way back to compensating, not leaving all the work to the weak heart. Not to leave all the work to the weak heart, but to open up the periphery. And that was an incredible relief, which was dramatic that night. He had to go out 12 times, but his feet were never so swollen again because he got something in his hand, which opened up a regulation that he was not able to do himself. Because this shortness of breath, this stress, this life can only ever be done slowly, because the heart, or rather it is not just a problem of the heart, but also stress at that moment. Imagine the heart pumping against a resistance that puts a strain on it, and now the resistance opens like a dam wall that you open, then it also goes. That is a distribution of force, a completely different distribution of force. And that was for me at the beginning a very nice experience to observe. We can't observe many small things in the moment. We don't measure it by that either. I feel much better. No, so much has happened since I picked you up. Give your body time. And it will change over time. You can trust that 1,000%. Because it took a lot of time for him to get into this health situation. And these are like pieces of a mosaic. And he will then show you that he is in a better position. You have to give him that, and then you have to support him.
I hope you were able to take something back with you to regulate your stress levels. Thank you very much for watching. Have a wonderful time. See you soon, and bye.